Breast cancer has become a global problem. In recent years, it's become the most common cancer among women worldwide. Hundreds of thousands of women are affected every year. Breast cancer is usually noticeable by a lump in the breasts. At that point, you can be sure that something bad is happening there. But if you notice the early symptoms, you have a much better chance of stopping the cancer. One of the biggest problems with breast cancer is late detection. Many organizations advocate for early detection and diagnosis by trying to raise awareness. If you have any of the signs, do not ignore them. Instead, schedule a visit to the doctor. Signs of breast cancer: aches and pains in the breast area. As we mentioned at the beginning, a lump in the breast could be a sign of breast cancer. But before the lump develops, you'll notice unexplainable pain and aches in the breast area. The moment you feel unusual aches, along with occasional throbbing and discomfort, visit your doctor. One of the common mistakes women make is they think of this pain as isolated and localized. But breast cancer is not always a full lump. Sometimes, there's no lump at all. Sometimes, it can be just strange-looking skin appearance, accompanied by pain in the chest area, hoarse throat and annoying cough. Breast cancer is not an isolated type of cancer. In most cases, breast cancer spreads to the uterus, but it can also spread to the lungs. In the latter case, the result is persistent coughing and a hoarse throat. And no, that is not your regular cold-flu cough. You'll notice the difference, as the coughing never stops. Some statistics show that in more than half of the cases, breast cancer spreads to the lungs. The result is shortness of breath, dry cough, and hoarse throat. Unexplained fatigue and tiredness. Fatigue and tiredness can be symptoms for so many diseases. For example, fatigue is also a symptom of magnesium deficiency. However, if you haven't done anything to trigger the tiredness and fatigue, it might be time to think about cancer. Yes, you can be fatigued by physical exercises, but if you feel tired without having done any physical exercise, you may have breast cancer. The nipples. Your nipples are one of the best indicators of breast cancer. As with a lump, a change in appearance of the nipples is a very visual early sign of breast cancer. Here are some symptoms you might experience: pulling in of your nipple, itchy, sore, and scaly nipple, rash on your nipples, nipple discharge that starts suddenly, irregular bladder movement. Irregular bowel movement occurs as a result of hormonal and chemical imbalance. Women with breast cancer experience a change in their hormones, and as a result, their urethra dries out and they experience urinary incontinence. Back pain. You're probably wondering how back pain can be an early sign of breast cancer. It's simple. It has to do with the mechanics of the body. When breast tumors are developing, they put pressure on the ribs and the spine. As a result, you experience upper back pain. But we have to differentiate between back pain from herniated disc and spondylitis and breast cancer. For the latter, the pain feels like it comes from deep within the bones, so you need to be aware of any changes in your upper back, neck, and spinal column. If you notice unexplainable pain in the upper back, it's time to visit a physician. Here are some later symptoms of breast cancer. If you ignore the early signs of breast cancer, your cancer will progress and spread. As a result, you'll experience more severe symptoms and signs, such as visible veins on the breast, enlarged lymph nodes, vaginal pain, orange peel texture on the skin, enlargement of one breast, dimpling of the breast surface, unintentional weight loss. If you like our video, please give us thumbs up and share this video with family and friends. Thanks.